Zika virus, often called Zika, is a growing concern worldwide. This virus can cause serious health problems, particularly for pregnant women and their developing babies. Scientists first discovered Zika in 1947 in Uganda's Zika forest. The virus gets its name from this location. Initially, Zika cases were rare. However, a significant outbreak in the Americas during 2015 and 2016 caused international alarm. Zika belongs to a family of viruses called flaviviruses. This family also includes other mosquito-borne illnesses like dengue fever and yellow fever. Aedes mosquitoes are the primary culprits in spreading Zika. These mosquitoes thrive in tropical and subtropical climates where warm temperatures and standing water are common. Zika is a single-stranded RNA virus, which means it replicates differently than some other viruses. This unique replication process makes it difficult to develop effective vaccines and treatments. Understanding how Zika spreads and the risks associated with infection is crucial for public health. The World Health Organization recognized the seriousness of Zika during the 2015 to 2016 outbreak, declaring it a public health emergency of international concern. This designation helped mobilize resources and research to combat the spread of the virus. Zika virus, or Zika, is a member of the flavivirus family. It spreads through the bite of infected Aedes mosquitoes. These mosquitoes are found in tropical and subtropical regions. Transmission occurs when an infected mosquito bites a person. The virus enters the bloodstream and replicates. Zika can also spread through sexual contact, blood transfusions, and from mother to fetus. Sexual transmission can occur without symptoms. Safe sex is crucial in affected areas. Blood banks screen donations to minimize risk. Transmission from mother to fetus can cause birth defects. Microcephaly is a significant concern. Once the Zika virus enters the human body, it typically takes about 3 to 14 days for symptoms to appear. This period is known as the incubation period. However, it's important to note that a significant proportion of people infected with Zika never develop any noticeable symptoms. For those who do experience symptoms, they are generally mild and last for a few days to a week. The most common symptom is a mild fever, often accompanied by a maculopapular rash. This type of rash appears as flat red areas on the skin that may be covered in small bumps. Other common symptoms include conjunctivitis, or red or pink eye, muscle and joint pain, headache, and a general feeling of being unwell, or malaise. These symptoms are often mistaken for other viral infections, making diagnosis based on symptoms alone challenging. While most people recover fully from Zika infection without any complications, the virus can sometimes lead to more severe health issues. In rare cases, it can cause Guillain-Barré syndrome, a serious neurological disorder that can lead to muscle weakness, paralysis, and even death. Section 4. Diagnosis and treatment of Zika. Diagnosing Zika virus infection can be tricky because its symptoms often resemble those of other mosquito-borne illnesses like dengue and chikungunya. Doctors rely on a combination of factors to make an accurate diagnosis. First, they consider the patient's medical history, especially recent travel to areas with known Zika virus transmission. Laboratory testing is crucial for confirming a Zika virus diagnosis. Blood tests can detect the virus's genetic material, RNA, or specific antibodies the body produces in response to the infection. There are two main types of blood tests. The polymerase chain reaction, or PCR test, identifies the virus's RNA, providing rapid and accurate results, particularly during the early stages of infection. The enzyme-linked immunosorbent assay, or ELISA test, detects antibodies the body makes to fight Zika virus. While highly accurate, it may take longer to yield results as the body needs time to produce antibodies. Unfortunately, there is no specific antiviral medication available to treat Zika virus infection. Treatment primarily focuses on relieving symptoms and supporting the body's natural healing process. Doctors recommend rest, plenty of fluids, and over-the-counter medications like acetaminophen, commonly known as Tylenol, to reduce fever and pain. Section 5. Prevention and control of Zika virus. Preventing Zika virus relies on reducing mosquito populations and minimizing contact. Effective mosquito control is crucial in risk areas. Eliminate mosquito breeding sites by removing standing water. Aedes mosquitoes breed in stagnant water. Empty containers like buckets and tires. Use insect repellents with DEET or picaridin. Wear protective clothing to reduce bites. Use mosquito nets, especially at night.